Driving it home with Patti Vasquez, Patti Vasquez. From global conflicts to greenhouse gases, the folks refusing to wear masks says, and politicians getting caught grabbing asses. She's driving it home with Patti Vasquez.
Thank you so much for joining us as we drive it home. I want to welcome a comedian, Emmy Award-winning writer-producer, Dwayne Kennedy. He was a writer with Kamau Bell on United Shades of America, and also worked with him on Totally Biased on FX. How are you doing today, Dwayne?
Hey, fine, Patty. How are you?
I'm very well. I'm very excited.
Yeah?
Because I need you to meet our next guest in person someday, because I've had the honor of meeting Congresswoman Lauren Underwood. Hello, Congresswoman. How are you doing today?
Hi, Patty. I'm so happy to be here with you.
I just, you know what's so funny? I knew you were young, but holy cats. She's a baby, Dwayne.
Oh, yeah. Not anymore.
Oh, please. You have any, you say some other time, because no one even needs to know what she's under 40, Dwayne, is all I'm saying. I'm just saying, and the work that you've already done, what you've accomplished, I just have to say, it's an honor to have this conversation with you. First of all, let me just talk about what's the top of the news, which is, how are you feeling about this election right now? We want to talk about healthcare and some of the work that you're doing. Do you want to talk more about the healthcare? We can do that if you'd like.
Well, we're less than a week from the election at this point. I think the Democrats have incredible momentum here in Northern Illinois. Across the country, I think Vice President Harris has been running an incredible campaign, and I'm looking forward to closing out this final stretch and seeing all of our fellow Americans go out and vote.
Yes, I love it. Well, we'll talk a little bit more about that if we have time, because I have said this over and over again. When I ran for state rep in 2020, and what I've been ringing the alarm bell for a while is that the crisis of our generation is healthcare. That's really what I believe. I know we can talk about a lot of other things, but if you cannot afford to care for yourself or others, if you are worried about losing your home because you have an illness, we are not a healthy country, are we?
No. And, just today it's in the news that Speaker Mike Johnson has this pact, an agreement with Donald Trump to repeal the Affordable Care Act and enact what they're calling major changes. You know what? I hear alarm bells. When these guys start taking away our health care, we know it is bad news, and we have to vote like our lives depend on it.
We absolutely do, because, after all, Trump has a concept of a plan to replace the Affordable Care Act. Where do we even begin with that? He was in office for 4 years. It's been 9 years since he told us we were going to replace it with something beautiful. Have the Republicans had any answer for how to address this major crisis?
Well, you might remember 2017 when the House passed a repeal bill that my opponent, the guy I beat, Randy Holgren, voted for. That's why I jumped in and ran for Congress the first time. They had a big celebration on the White House lawn, and then it took John McCain stepping forward to save us, right? I remember that. And since then, the American people have had it, and the Affordable Care Act has been more popular than ever. I wrote the first bill to help to fix some of the challenges with the ACA to truly be affordable for people. It's called the Healthcare Affordability Act. And it says that no American would pay more than 8.5% of their income for silver-level marketplace plans. So that's the good coverage that people want. And these tax credits have been so popular. 21 million Americans enrolled in coverage last year. 4 out of 5 people can find a plan for $10 or less a month. And we've had the lowest number of uninsured Americans in history, thanks to my bill. And so, when I hear these MAGA extremists talking about undoing this progress that we've made, I get really worried.
As we all should be. So tell us, if I can't. It's so hard. Is it hard to think past Tuesday right now with all these? Because you obviously have to do all of the work, with the focus in mind that we're going to accomplish this. But so much hinges on Tuesday, doesn't it?
It does, because we know that there is such a stark difference between Kamala Harris and Donald Trump. Kamala Harris is offering a new way forward. She's talking about an opportunity economy for all Americans. She understands the need to protect health care coverage for people with pre-existing conditions, and she's embraced this legislation that I wrote and is working in partnership to make these tax credits permanent. Donald Trump supports the dangerous Project 2025 plan that seeks to repeal the ACA, that seeks to ban contraception, ban abortion nationwide, limit access to fertility services like IVF. These guys, they want to control us. They want to control every aspect of our lives. And I think we can't let them win.
No, we cannot. And so with the work that you have done in helping Americans save money, with the Healthcare Affordability Act and permanently lowering healthcare costs, what can folks do? What should we be paying attention to and calling our electeds and demanding more? Because we have a lot of listeners that live in red areas. We also have folks that need to know what's being done at the federal level. What do you want to share with them?
That they should reach out to their congresspeople and ask them to co-sponsor the Healthcare Affordability Act of 2024. And they can call the senators and ask them to support this bill as well. We're going to have a big tax fight next year in 2025. Because, Patti, I know you remember the tax scam when Donald Trump passed this big tax bill that gave all the benefits to the billionaires and the corporate tax chiefs, right? Well, those provisions are going to be expiring next year. And so we have to put forward tax reform that puts working families and small businesses first. And these healthcare tax credits will be a big part of that fight, along with the child tax credit, right? And all these other programs that are so important to families across our community.
I know that folks are not going to be surprised that in many of the states where they have now banned abortion care and reproductive rights, maternal health is something that has become absolutely drastically impacted. But in Illinois, we still are not, we have rural areas where women have to drive an hour to an hour and a half for prenatal care and for childbirth services. We also have urban areas. Black women are often more likely to die from pregnancy-related causes than white women. What kind of work are you doing? I know that you have is it the Momnibus?
That's right. So I co-founded and co-chair the Black Maternal Health Caucus that has a really clear purpose of ending our nation's maternal health crisis, right, and elevating solutions to get rid of the disparities that we see where Black moms and rural moms and Native American moms are more likely to die of these preventable causes, right? 80% of the deaths in our country are preventable. And, I think in 2024, we can all stand together and say that should not happen. And so I teamed up with then Senator Kamala Harris back in 2020 to introduce the first version of the Momnibus. Now, that's a big word, and it combines the legislative word omnibus, which means package of bills for moms. That's how we get Momnibus. And now it's 13 bills in one designed to address every clinical and non-clinical factor contributing to preventable maternal death in our country.
Okay, and that's remarkable. How are you doing with getting other legislators involved in this? Because one of the things that I've talked about, so I used to work in communications for big corporations, and my job was basically to get people to these meetings and tell them about different companies that were providing services, whether it was like surgical. One of them was for endometriosis, and the thing that was really hard, one of the things that was really hard for me was, most of the field of finance and investment is men, and they were icked out by it, right? So I've always wondered about this because women's health, like the Pap smear, has been done the exact same way since 1927. And I think that part of this is because men have been in power politically and financially. So when you're, trying to, I know that you need to have, a collaboration and sort of a coalition of people. How is it coming along with convincing dudes in power to collaborate with you on this?
It's been really interesting. The Black Maternal Health Caucus is one of the largest bipartisan caucuses on Capitol Hill. And it's not just women. We have a lot of male members who believe that moms shouldn't be dying of childbirth or pregnancy-related complications. And they, all have really deeply personal reasons for joining our caucus. Some of them choose to share why they're part of it. Some of them are just, allies or supporters, and we're grateful that they're, supporting our legislation. But it's been a really inclusive effort. We have a Dad's caucus on Capitol Hill,
Nice.
and the Dads have now endorsed the Momnibus, and we've done joint events. There's been a group of fathers who advocate on Capitol Hill together because they've lost their wives, partners, girlfriends due to a maternal health crisis, right? These women have died, and they are reaching out to lawmakers asking for the passage of the Momnibus. And so we have a really inclusive, diverse coalition, and we also talk about how this crisis touches every zip code in this country, right? It impacts all of us. This is not a bill just for Black moms or just for certain people. No. This is a bill that improves the quality of care for everybody. And I think that men are a big part of the solution.
That's fantastic, because I just don't think people realize in this country, because, culturally or even in the media, we have this idea of moms and they're doing it all. And part of it, that pressure is, it takes its toll mentally, but physically, it's still hard to say this, that we have higher maternal mortality rates than other higher income countries. I mean, it's astounding to me. And we have the tools at our disposal, including things that we learned during the pandemic, right? Having digital access. So for folks who can't make it to a consult by Zoom works very well. And that's included in this Momnibus, isn't it?
Right. So there is some telehealth components, but what's been really innovative are things like remote blood pressure monitoring,
Ooh.
right? So the cuffs that connect to your cell phone, and then your provider is able to monitor your blood pressure, right? Because we know that preeclampsia is really challenging. But the leading cause of preventable maternal death in our country is maternal mental health, right? Because when you combine substance use like overdoses and suicide, those are killing more moms than anything else. And so when we have tools in our phones that help a mom in crisis access help right away, that literally saves lives. So working with the Vice President, Kamala Harris, there's a new maternal mental health hotline, 1-833-TLC-MAMA, M-A-M-A. And when moms call that line, they get connected with a provider right away. You're not getting through like a bunch of different prompts and referral numbers and all this other stuff. No. You're getting help right away. But there's other ways that our legislation can expand access to that mental health support as well. And that's a bipartisan bill in our package, right? So when I talk about these kind of common sense bipartisan solutions, that's what's in our legislation.
That's fantastic. I encourage folks to find out where are you in the process? When would this possibly be introduced? It's made it through all the different layers of collaboration and writing the bill. Where are we as far as taking it to the floor?
So we are approaching what we call deal-making season, Patti. Some people call it lame duck, but after the election, policymakers get a little incentive to get some things done. And so we are working hard to get the Momnibus attached to other bills that will be moving to the floor. As you know, as Democrats, we are not currently in the majority, but next Tuesday, we might be back in the majority if we win all these races. And so we have to work with our Republican colleagues to get floor time. And so we're working hard to do that before the end of this calendar year.
Outstanding. And again, I encourage folks to reach out to your legislators. I'm trying to find a best way for folks. You can go to USA.gov, folks, if you're not sure who your electeds are, because as much as our listeners are fantastic, sometimes, things get past us or we don't realize we can actually make an impact. What is it like when somebody reaches out and you have an overwhelming amount of people saying, hey, this is really important to me? How does that impact your approach to legislation?
When I hear from my constituents, I pay close attention. It is so valuable to hear from the people in our community about the issues that are most important to them. And as they tell their stories, storytelling is so important. It helps us connect on our shared humanity, our shared experiences. And, we want to help improve your life, right? We want to support your family. We want to support your business and allow for more opportunities for all of us. And so, I really am grateful when people take the time to reach out, whether it's a phone call, whether it's an email, or whether they're handwriting a letter, because some people still do that. It's just really important to get that kind of feedback.
And what's your preferred website for folks to learn more about you and learn about your mission, the work that you do?
Well, since we are in campaign season,
yes,
Patti, they can find us at Underwood, FORCongress.com. UnderwoodForCongress.com.
Excellent. And I have another question for you. What are your plans for watching the election night returns?
Well, I think we're going to have a little party, as one does.
Uh-huh.
So people can follow me online at Lauren Underwood to get all the details for our election night gathering. But we have a lot of work to do before we party, Patti. So, this is what I say. If you haven't done a shift knocking doors, if you haven't made phone calls to voters, if you haven't texted people reminding them to go vote and vote early, like get it done today, get it done tomorrow, like you really have some work to do before we start making election night plans.
So I have been, and Dwayne will tell you, Dwayne, would you say I've done a couple of doors here?
Couple thousand? 4,000?
I've been going to Wisconsin every weekend since August, on and off since April. This last weekend we did about 300 doors. So we've been in Janesville, we've been in Elkhorn, Racine, and Kenosha. And I have to tell you, I'm feeling solid about some of these communities. You're beyond having to get the work done and getting folks out to vote. It also helps me manage my anxiety. I'll be honest with you, Congresswoman.
Yes, that productivity and honestly the connections, right? Because there's more that unites us. And even if someone ultimately is not going to support the same candidate that we support, they still are grateful for the outreach. And I love that.
Yeah, I agree. Well, I'm really grateful to have this opportunity to speak with you about the work that you're doing. Again, we've been talking to Congresswoman Lauren Underwood. You can go to underwoodforcongress.com to learn more about her campaign and the work that she does. We'd love to talk to you again soon. Maybe we can check in with you on election night, just to see how we're doing that night. If we reach out, would that sound good?
Sounds good. Thanks, Patti. Thanks, Dwayne.
Thank you.
You're welcome.
Bye, Congresswoman. Have a great evening. Let's go get them.
Okay, bye.
Bye. And thank you so much. By the way, WCPT's election coverage is sponsored by the Chicago Federation of Labor, standing up for working people in Cook County.